Hello, and welcome to Nula Health's blog, where we discuss topics related to reproductive health and all things for people with uteruses. Today, we're joined by Dr. Nirshila Chand, who is a doctor of public health, and we're going to be talking about why 15 minutes in the doctor's office is just not enough. Now, before we get started, it's important to understand the scope of the doctor's visits today. The median length of a visit in your doctor's office is only 15.7 minutes. And in this video podcast, I, Noella Casa, founder and CEO of Nula Health, and Dr. Nirshila Chand, doctor of public health, will discuss why 15 minutes with your doctor just truly isn't enough time to deliver the individualized, personalized care that you deserve. Now, 15 minutes was adopted with increasing demand of healthcare services and the fee-for-service model, which we'll touch on later throughout this call, which essentially what that does is pay healthcare systems per service that a patient receives. This has impacted the healthcare system to operate as an assembly line by decreasing the time spent with a patient rather than the time provided to prevention and healing efforts with a patient. So I'll go ahead and pass it over to Nirshila, who can introduce herself.
Hi, thank you for having me, Noelle, as part of Nula Health. I am a big fan of Nula and what you are developing and creating. It is a very, very much needed service for our communities, especially our multicultural communities who need in-language care services, especially surrounding one of the most important parts of our lives, our reproductive health. And a little bit more about me. My background is in community health education, policy work, and research. And I am very much passionate about bringing public health cultural service care to our communities. This has been shaped largely as I grew up here in California. I immigrated here from the Fiji Islands to the Bay Area in California. And I grew up in a very much large non-Indian community, very much so. It was a Latinx community. And so we'd use the same healthcare system as our Latinx community members. And I realized with my family, my parents and my grandparents, that we really needed in-language care service at that time because of my parents' level of understanding, my grandparents' level of understanding of their health. And ultimately, it came down to me and my siblings and my cousins who served as interpreters for our family. And being a young child and seeing that, it carried that on into as I was looking into different options for my career path, and health kept on coming. It was something that I just truly felt just passionate about, and the community aspect of it was even more passionate. But as I went on to do higher education, I had so many mentors encouraging me to go on into public health, not in the clinical side of things, but more in the non-clinical side, where we develop preventative care services, develop messages around health education, and support and get our communities more visible in terms of the support that they need. And so I'm truly definitely very passionate about it. And I also do a lot of work with bringing visibility to my own community. So, and I am passionate about this, why 15 minutes is just not enough, especially for someone, I mean, for anyone, but especially I'm going to give example as a multicultural individual going in and seeking this service and care. So.
Yeah, absolutely. I mean, I think we can all relate to a time where we might have felt rushed in the doctor's office. Like for me specifically, my journey in building Nula really stemmed from me feeling like my care was very transactional. I was that 1 in 5 women who felt dismissed and ignored in my healthcare journey. And so, it's truly a prevalent issue where that impacts not just patients, but also physicians in terms of how we deliver the state of healthcare today. And so actually that leads us to kind of my first question. And before we kind of talk about why 15 minutes in a doctor's office isn't enough, I'd love, if you don't mind, walking us through, like, what does the typical or average doctor's visit look like as a patient?
Well, I mean, from the patient side, there is so much preparation that comes about in making a decision to actually go see a doctor that we actually don't take into consideration because it's more than 15 minutes. And I think the COVID pandemic has really helped us to see that there are so many disparities that lie within different population groups in terms of access to care. and access to care is before getting to the front door of going into the care system, but also access to care in terms of what happens in the preparation part. So finally making a decision, the contemplation part of where you're making that decision. Well, I have um, an ailment of some sort, or want to get a physical checkup or whatnot. I'm going to pick up the phone now finally, or go into my portal and figure out a way to make an appointment with my doctor. That's one aspect of it. And then picking up the phone, actually making that appointment. If you're someone who's working, you have to align your schedule with taking time off in the middle of the day and taking your taking hours off. Then actually deciding, well, how am I going to get there? The route of care. How does my health insurance look like? What is my copay? So many people just don't
Mhm.
understand what their copays are, what their deductibles are. And if you have HMO insurance versus PPO insurance, what does that look like? So there is so much preparation that happens priorhand. And if you're someone who just doesn't speak English, that's a whole nother level of care. I
Mhm.
taking someone with you, and then if you don't, if or you need an interpreter, so you have to let your healthcare provider know that priorhand. Also, if you're someone that doesn't have transportation, you have to figure out that transportation system.
Yeah, access to care is something that, impacts millions of Americans, and something that I think the healthcare system is traditionally overlooks, at least from my own experience. It's especially as a patient and someone who's been a patient, it's something that, yeah, I personally have experienced myself. It's like, okay, I have to request time off of work to go to my appointment. And I've always, I was privileged to have access to high quality care being in a large metro area. But imagine, the patient who has to, or the woman who has to travel an hour, 2 hours to see her physician. So all that being said, we talked a lot about having access to care, just entering into the door of your provider's office. Now, what actually happens in the appointment itself?
Thank you. So that now from the access to care, we're moving into this paradigm of quality of care where you're
Mm-hmm.
actually seeing the healthcare providers. Now, these providers are not just a physician, it's also a medical assistant, the receptionist, and anyone else that is inside of the clinic or the healthcare setting that works there. Even the security guard is a part of it too. That's how I see it, the whole system and how it's set up. And when I look at quality of care, I look at it from I have such an equity lens now developed through my work, and it's only becoming more stronger. If you're an LGBTQ plus person, do they have resources for my community groups that I will feel welcomed? If you're someone with a disability, do they have ramps going up? Do they have larger fonts in the reading so that I can read it? Now, if you're someone who's can't speak in English, most of our healthcare system is in English. What type of access to that kind of, what type of resources do they have
Mm-hmm.
for someone who's a non-speaking English person? And once that is a big part of quality of care. And then once you actually get called in by the medical assistant for your biometrics, that that itself also takes a part of the 15 minutes of care. So you're getting your biometrics right, you're getting your weight, your blood pressure. Of course, you're going to have questions about your blood pressure if you know what questions to ask. What are the diastolic and the systolic blood pressure readings? I'm pretty sure
What does it
people,
mean?
what does it mean, right? How does that relate to the weight? Okay. And then the medical assistant is asking other questions as they walk you through the room. And while you're sitting there, they're obviously checking up on other types of going through your medical record, updating any of your information that needs to prior to the actual doctor coming in. And then you have a waiting period once they ask their questions. And the waiting period is pretty much, depending on how rushed the doctor is or how busy that day is, the doctor will either come in immediately or not. That also takes a part of this whole 15-minute cycle. And then the doctor comes in and they have that one-on-one with you, ask you about your name. And if this is your first time you're talking to the doctor, there is this trust that you're building. Vice versa. Obviously, the doctor is doing that with you, and you're doing it with your doctor. And so that in itself, depending on who you are as a person, how comfortable you are asking questions and where you're coming from, that takes a whole part of the entire conversation. of them trying to understand, well, what is this person here for before they go into a physical examination and doing your heart rate and you're checking any of your other types of care system, and also getting to know other types of care for you. Other types of care for you is, well, do you have food access? Do you have or do you have
Mhm.
a housing? Do you have access to transportation? Because these are also, I'm now discovering, codes that they need to put into their system so that they have a better understanding of other social needs that the individual has, which actually doesn't even get prioritized. So there's so many things that are a part of a person's care, and again, it goes back to your healthcare insurance. If you have HMO or PPO, then that is how you refer to another specialist to go speak to. So for a woman, if you have an HMO, then you go in through see your primary care physician, and they refer you to a gynecologist.
Mhm.
It doesn't even happen there at that meeting. You have to rearrange your day again to go and have another meeting with the gynecologist. So, but then again, but at the meeting that you're having at the moment with your doctor, there is there I don't it is so difficult with the types of questions to ask and also the understanding of what they're saying. And I feel like
Mhm.
sometimes as providers, and this is something that I keep on reminding myself, even when I write about health education services, or when I'm talking to my friends who are providers and they're using big, I was just like, break it down in simple words so that someone does not feel fearful. Someone feels understood. They feel empathy. Because I feel like what's happening with our healthcare system over and over again is that it's the empathy, that touch, that
Mhm.
preventative, that the healing touch is just really missing now. And that is where patients feel so unseen. They feel
Mhm.
not heard. They feel that um, they feel mistrust with the healthcare system, and they continue to delay their care over and over again. So um, I'm just going to stop there.
Yeah. Yeah, and absolutely. And as you walked through an average visit with your doctor, in reality, it's less than 15 minutes if, the setting up of and analyzing biometrics is part of the visit and part of those 15 minutes. If waiting for your physician and waiting to be seen is part of it, you're truly spending um, under 10 minutes with your doctor. And so it's no surprise that for some people and many people, it can be hard to find the right questions to ask, especially when you might feel like you aren't being heard, you aren't seen, or there's just a general sense of kind of anxiety or fear around not knowing what's going on with your body if you're truly going there for something that is causing an issue for you and your health. And so now that we walked through the state of the average appointment length, um, why 15 minutes and truly, like, now that it's really feels like less than 15 minutes with your doctor, it really feels like that's a pretty short time to spend with your physician. Why are visits so short today?
Well, it has a lot to do with our system and the way that the healthcare system is designed in America. And a lot of it is because we are in a fee for service type of model, and each healthcare system has their own ways of operating. I think we all know that yes, we have the healthcare policy, the Affordable Care Act, which is our national policy for healthcare. But the way that each state operates with our healthcare system, they have their own way. We pretty much each operate as its own country, and
Mhm.
county by county, in each within each states, they operate differently too. I think one of the biggest reasons that this is happening is because either there is a higher demand now, and there is just not enough, probably, doctors, or just not enough to provide for the higher demand in service, or or this whole model of fee for service, which is really sort of preventing, allotting a specific amount of time for people to come in, to go in to see their to see have that interaction with the doctor.
Mhm.
And I know that this is very different among different types of physicians and different types of care and different types of model of care. where it's a functional medicine versus like traditional medicine versus a primary care, Western medicine. Each of them have their own way of interacting. And I also noticed that this is different across specialty of care too. If you're going to see a primary care physician during just for a physical health is very different than when you go see sort of um, uh, let's say an oncologist, because an
Mhm.
oncologist spend a longer time really explaining what's hopefully explaining what is really happening in your body and what the purpose is for the examination and for the interaction. So the systems of care has just really evolved over time, and I know that it's just become really deterrent for a lot of people. It's actually becoming really damaging and preventing many people from seeking care and adequate care too. There's so much misdiagnoses happening, or no diagnoses at all that
Mhm.
could prevent with actually having more time. And now there's this more conversation happening. We need to move to a value-based care system where we look at the patient as a valuable individual, and also take away all of this fee for service, and really have this interaction healing what medicine truly is meant to be, which is um, going into healing, going into preventative care, having awareness of who the patient is, listening to them, having conversation with them, and really just seeing that they have a better knowledge of their own bodies and their care. I think that's what really takes away from a lot of our understanding as people. And I know that there's a lot of misunderstanding and missed messages, especially in my community, that happens. The higher the education, how educated you are, the better quality of care you have, and the better knowledge of your health and body that you have. That is not the truth. You can be as highly qualified as possible in all areas, make the most amount of money, and know very little about your care. That's absolutely not the case. So I feel that we need to bring healthcare down to a literacy level where everyone can understand it and understand what sort of things impact, and understand the whole breadth of it, the body itself and your environmental surroundings that are also contributing, which contributes like 85% of our healthcare is outside of our healthcare system. So
Yeah, yeah, absolutely. And so, that brings us to, you were talking a lot about centering the individual. And Nirshila, this is where you as a practitioner have a lot of synergies with our mission at Nula Health, is truly prioritizing that person as a whole person, an individual with their goals and total health in mind. So can you walk us through like what is individualized or personalized patient care and why is it so important?
oh, absolutely. I feel that individualized, personalized care is we've actually moved away from it so far beyond, but that now we're actually figuring out a way to come back to it now. Each of our bodies is so different. Yes, you and I we both identify as women, but we both have different genetic makeups. We both have different ways that we live that impact our health. And one of the things is, so much of, I'm going to just talk a little bit about research. So much of research really aggregates many, I'm just going to talk about research among women, specifically gender,
Okay.
women who identify as sorry, I'm like
Yes.
mumbling here. Um, women who identify as women who generally identify as women. Okay, so there are. So I'm specifically just gonna. I'm going to give an example of women women, and there's so much aggregated research just on women, and this specifically on women, let's say between the ages of 40 and 55, who are at higher risk of having a, let's say, breast cancer. But again, this is just an aggregated amount of women that do. We don't know specifically how this impacts each person in terms of their personal needs and their personal care, and if they are at higher risk. And that
Mhm.
amount can tell us only one thing about women, but then again, my question is, well, there are actually people that are at risk even prior to the age of 40. And it depends on our body and our genetic makeup. I've known about so many people who have been diagnosed with breast cancer in different stages at the age of 32 and 35. And I just keep on thinking, I was just like, don't let research be so misleading,
Mhm.
and don't let that sort of impact the type of care that you deserve to have, because this is where individualized medicine, you have to see each person as its own individual person, because each of us have our own needs. We're all shaped genetically differently, we all live in different communities very differently, we all have access to care very differently, and quality of care, and our needs are so different that we need to really prioritize giving individuals their own care, and
Mhm.
really see them in their own way, and also talking to them in their own way too. So I'm a huge advocate for it, and this is where a place like Nula that prioritizes individualized care is so important, because this is, I feel like now we're moving a lot of, your organization as well as many others that I'm seeing, they're really advocating for this whole and individualized
Mhm.
medicine piece, which is so integral to medicine at the moment.
Yeah, yeah, absolutely. And I think the gaps in care that are present today really do stem. I mean, it's a very complex issue, but I think also heavily rooted in the lack of research and understanding about individuals' bodies and genetic makeup. Like, for example, it wasn't until 1991 until they required women to be part of clinical trials, which
Exactly.
was mind blowing to me when I first learned of that statistic. And in addition to that, in my own reproductive health journey, my chronic condition, I learned more about how my condition has the highest phenotype for risk for infertility for Mexican women at a conference, not in my doctor's office. And that was really surprising to me too. So centering that individual and truly understanding them as a whole person, from their physical health, their background and history, their social determinants of health, their genetic makeup, their own goals, and just emotional well-being, I think is so critical to delivering that high quality, value-based care that can truly reshape um, their needs and their journeys within the healthcare system.
Thank you for sharing that.
Yeah. And so, Nirshila, my last question for you is, like, what can patients start doing today to feel empowered and supported in their doctor's office?
Well, I mean, I feel like I have so much to say in this area, and quite honestly, I would say to really understand. Well, there isn't really any way of understanding, but to ask yourself, what is the purpose of your visit? Really go in with that mentality. I know going in to see a doctor, no one wants to go in and see a doctor. It is a very terrifying thing. It really is. I mean, I have gone through it my own self. I have my own family going through it, and many multiple times, but really going in with this purpose of what is my intention to go see my doctor. And I know we grow up in communities and cultures where doctor's visits are not prioritized until we get very sick. Preventative care, where you go in every single year to just go get just see where biometrics are, and just to see that you're healthy and well, that is not practiced in
Not a
many
thing. Yeah.
communities, not at all. So when to encourage people to go in, that is the one thing. We go in, that we have this care that is designed for us. We go in to receive this care because it's just a great way of just knowing where we stand, and we do it for ourselves, we do it for our families. That is how I usually tell my family. But a great way to be prepared for is just having, just preparing your mindset, and also making sure that all of your systems, all of the processes that you need to take to get there. For instance, you have your transportation routed, you have
Mhm.
your questions that you want to ask the doctor, and you can prepare, you can take a person with you, whoever that may be. You also let your provider know if you need an interpreter. You understand your health insurance policy, whatever that may be. If you have Medicaid, if you have HMO, if you have PPO, what are your copays? If you have any, what does that look like? Please know it. I have seen people go up to their doctors and they find out they have a copay, and they're like, I'm not paying that and I'm leaving. And I'm just like, what happened there? Like, and I know that was a confidential question, but you can't help but overhear it. And I was just like, this is such an important, like, people should not be turned away because of their copay and not knowing about it.
Mhm.
So please understand that. Have a list of questions, whatever that may be. Like, have that question ready. And you know, a lot of us nowadays, there's portals that are being developed for us to log into and track. Nobody goes and checks it. Hardly anyone who knows how to operate a computer can go do that. My mom does not do that by herself. I help her. But what we have started to do with her is just write down. We have a notebook and we just started writing down a lot of her
Mhm.
care, what date and what we talked about and what it was. I think, you know, having, if you're, depending on who you are, like having your family members being a little bit involved if you wish to, and also personally just keeping track of that too. And also just making sure that you know, you take knowing that this is your responsibility for yourself, and also sharing that with your doctor if you're comfortable. I know a lot of us have, I've had experiences with physicians where even I haven't been able to be seen. And I've actually had a point where I went in for my own personal thyroid questions, and they sent me a journal article afterwards, and I and I replied back, and I was just like, I don't think someone like me is included in this journal article, depending on if like there was an Indian woman from Fiji of my age group being a part of this clinical study or this
Absolutely.
research. And I was just like, this is not working out for me. Like, and so
Yeah.
and then I had sent them a whole list of questions, and then they replied back to that. I was like, this is what we need. So you have to be also be an advocate for yourself too. And it can be one of the most challenging things to do. It really is. But
Mhm.
being that advocate and being and really stay, because this is the only way that the healthcare system can listen. If they,
Right.
you need to, and if not, just be hopeful of that there is change happening, even though it's happening in increments and little bits.
Yep.
So fully just, you know, this, I my biggest advice is to just make a list of questions, understanding your route, understanding your transportation, being prepared, mentally prepared, going in, asking all those questions, and know, and also knowing that you can also go back and ask more questions too. That is your right as a patient. That is your right as having healthcare insurance, having healthcare. Sorry, in America.
Yeah, actually, that's actually something that I didn't know was a thing until probably in the last 5 years, is that I could actually follow up with questions after
Exactly.
the visit. So,
Not many of us know that. Even I found out very late too, until I started to interact via my portal. I was like,
mhm.
oh wow, this is actually functional and it's actually working. So
Well, Nirshila, this was such an incredible conversation. Thank you so much for sharing your insights and your wisdom. I'm sure that our community will find such tremendous value out of our conversation today. So I just want to say thank you so much for making the time. It was such an honor to have you.
oh, thank you so much, Noelle. I am so happy that I'm getting an opportunity to share my insights, and also for Nula and the journey that you're on. Continue going. I am all the way supporting you, and you're one of your biggest fans. And I can't wait to see where all the places Nula will just grow and become into, and providing services for all of us. So,
Thank you. We'll change the world together.
oh, absolutely. Thank you.